Although a great deal of progress has been made in the provision of life skills courses, Namibia still struggles with insufficient levels of training for trainers and weaknesses in the outreach of out-of-school youth. The Ministry of Education said they have noticed that young people often don't receive the correct information to properly prepare themselves for sexual activity, leaving them vulnerable to abuse, sexual transmitted infections, pregnancy, and HIV.
Good quality comprehensive sexuality education contributes to building critical skills and attitudes that, if combined with accurate knowledge, leads to the development of healthy behavior. Good quality comprehensive sexuality education also addresses some of the driving forces behind poor sexual health, such as gender inequality. Effective sexuality education is important because of the impact cultural values and religious beliefs on all individuals, especially young people, in their understanding of managing relationships with their parents, teachers, other adults, and their communities.
HIV remains a great concern across the country. According to figures from 2013, 37.7% of learners tested positive as a result of sexual activity.
However, in our context, there remains particular challenges in the delivery of professional health services to adolescents, including in areas such as informed consent and fuller disclosure of one's HIV status. Moving more strongly towards universal knowledge of adolescent sexual and reproductive health rights, psychosocial support for vulnerable and affected adolescents, and stronger follow-up systems, of course. The growing number of adolescents living with HIV who were infected as infants and do not know their status emphasizes the importance of improvements in the continuum of care, with particular attention to pediatric responses, as well as to improve age disaggregated all HIV data.
The minister further stressed that disabled people also often fall victim to being sexually abused.